So I was asked to present my talk on food allergies and intolerance. So let's discuss more about it. Considering my audience, most of us are either undergrads or interns or higher dignitaries. So let's see what is food allergies and intolerance. So food allergies is a cellular immune mediated reaction and it affects immune system. Whereas food intolerance is not an immune mediated reaction and it affects digestive system. Food allergies can be fatal, whereas intolerances are not life threatening. So it doesn't mean that if food intolerances are not life threatening, we can ignore it. Why? Because the percentage of population affected by food allergies are 1 to 2%, whereas with food intolerances, it's 20 to 30%. Let's see what are other differences between food allergies and food intolerances. Usually, food allergies are limited to airways, lungs, and GI and can affect different areas of body at the same time. Food intolerance, any organ system can be affected. Food allergy symptoms are usually acute, rarely chronic. Food intolerance symptoms are usually chronic, sometimes acute. And you can see common symptoms associated with food allergies and intolerances. So most important point you can see the amount of food necessary to trigger a reaction, food allergy reaction, it's one molecule can lead to food allergy reaction, whereas one bite to a plate full of food leads to food intolerances reactions or symptoms. So let's see what are the common food allergens. Globally, we have 8 food allergens reported. And what are common food intolerances? As listed, we have common food intolerances, fructose, salicylate, histamine, sorbitol, gluten, lactose. But most common in India are lactose and gluten sensitivity. So we can see the map of India with 28 states and different union territories. You can see different states have different cuisines. Each and every state follow their own diet and it varies across India. So based on literature, we have collected few food items from different regions of India, from northern region, southern region, east and western part of the country, and most of these food items based on the literature are reported by patients. So when we have a list of these food items, what are the symptoms associated with these food items? We have noticed the food allergy symptoms can be skin related, it can be oral, it can be respiratory, it can be GI, cardiovascular or neurological. And you can see the symptoms associated with each and every organ system. As we have symptoms for food allergies, similarly, we have symptoms for food intolerance. On the right side of the screen, you can see various organs are involved in food intolerance symptoms. And the left side of the screen, you can see most common symptoms associated with food intolerance. You can very easily notice that few of the food symptoms are overlapping with food allergies, as eczema, diarrhea, headache, fatigue, throat mucus. These are also found in patients suffering from food allergies. So if we have overlapping symptoms, what shall we do? We should diagnose them properly. Food allergy tests can be done. Usually in India, we diagnose food allergies based on clinical history. But there are specific tests which needs to be performed on patient to confirm that patient is suffering from food allergies or not, or it is just based on perception. Usually what happens, patients will start eliminating food items on their own based on their own history or own perception. So here comes the role of these diagnostic tests. They are allergen-specific IgE, skin prick testing, oral food challenges. We are not going to discuss each and every test in detail considering time constraint. Similarly, we have testing for food intolerance. Usually, we should start our food intolerance with monitoring the symptoms based on the intake of food. We ask patients to maintain a food diary. An elimination diet is followed based on that food diary. Elimination diet usually consists of three steps: elimination of suspected food, observation if symptoms are improving, and reintroduction of food and check the symptoms again. In all this process of diagnosis, we have a few necessary steps. You can see this slide, and one of the necessary steps is work with a nutritionist. Here comes the role of a nutritionist along with a clinician to plan a diet to overcome the challenges of food allergies and intolerances. How can a nutritionist play an important role? Let's see. Nutritionists can navigate food allergies and food intolerances by providing tips for a balanced diet. Let's see how a nutritionist can play. The most and first important plan with the first and foremost plan should be action plan. An action plan is very important for a nutritionist to plan a diet. Majorly, an action plan consists of 5 elements. It is criteria, medications, and dosages. We all know we have gone through chapters of drug and diet interactions. Based on the drug prescribed by the physician, we should plan a diet of the patient. Treatment instructions. Whatever treatment instructions are there, based on that, diet should be planned. We should always have required signatures on action plan and emergency contacts on those action plans. Once we have these 5 elements ready with an action plan, a dietitian or nutritionist can make recommendations based on treatment of an allergic reaction or any adverse reactions. Make sure we should get it signed by the patient or parent if the patient is a child under 18, and it should be signed by a physician and a dietitian. The action plan must discuss about accidental ingestions. And the last but not least, a dietitian should always be ready with a new action plan as and when required. Once we have action plan ready, now the next step is diet planning and diet counseling. How can a dietitian get into diet planning and diet counseling for patients suffering from food allergies and intolerances? For example, a child with allergies approaches to a pediatrician. Pediatrician asks a dietitian to plan a diet. So what can be the important factors can be considered while planning a diet? Include more of probiotics in the diet of the patients, as it helps to improve gut health, which can boost the immune system and reduce allergic reactions. There are few other listed food items and nutrients. You can see vitamin C should be included in the diet of the patient or child suffering with allergies because it acts as antihistamine and can reduce inflammation. Few other examples are a kid coming or a child coming with skin irritation. We can ask them to apply a thin layer of honey to irritated skin to help hydrate, soothe, and heal. Other options can be to make it more patient friendly. If patient is not friendly or not comfortable with English language, we should try to provide the leaflets or pamphlets in the Hindi language or whichever language patient is comfortable to understand, and we can include few points from this. For example, it's written प्रोबायोटिक्स के जरिए बच्चों को एलर्जी से बचाया जा सकता है. ये आंत में अच्छे बैक्टीरिया को बढ़ावा देते हैं. Same point I discussed in the very first example. It was in English. Similarly, it is written in Hindi. Always make sure that your leaflets, your information or your exchange of information with the patient should be patient friendly. Then comes antihistamines plays very important role in overcoming food allergies issues. We can have more of, like last example, you can see bromelain, an enzyme found in pineapple that reduces inflammation and swelling. So we can have more of vitamin C in the diet of the patient, more of pineapple, and more of butterbur or nettle leaf in the diet of the patient. And these are very commonly found in India. but we are not very much aware of these food items and these nutrients, as they play a very important role in patients suffering from food allergies or any adverse reactions. We have one more example. This is Indian milk ladder. Usually these days, many urban kids or urban parents come with the problem of having reporting that their child is suffering from milk allergy, cow milk allergies. So these are the 6 steps which can be considered. For example, first step is introduction of small amount of milk protein. How can we take? You can see on the step 1, it's second, Mari, it can start with Mari biscuit. Step 2, gradually increase. We can start with Gajar halwa. And all these are Indian food items which are easily available in our cities or in our residential settings. Similarly, we have one more example. For example, we have these days celiac disease increasing in India. So we have options. Instead of wheat wrap, we can substitute it with corn wrap. Instead of wheat parathas, we can give it ragi parathas. And the yummy Indian snacks can be substituted with sago tikkis or murmuras. So there are many other examples and literature available which a dietitian should consider, and why I brought this topic, food allergies and intolerance, at this platform, because these days what happens, patient either eliminate their food items on their own, considering so, or on basis of clinical history it is eliminated. We need to diagnose. And food intolerance, instead of eliminating food item completely, we should try to find out the substitute for those food items, because elimination of any food items may lead to undernourishment, malnourishment, or in urban areas kids are switching more to urbanization, more to western foods, more to pizza, burgers, because they are eliminating healthy vitamin, minerals, all nutrients rich food from their diet. So dietitians really have to play a very important role here. India is actually becoming westernized, urbanization is taking place. Food allergies prevalence has already increased in metro cities, in urban areas. Now it is going to hit rural India. Let's play our role. Food items should not be eliminated. We should find out the solution or substitute for those food items. I'm bringing this point here because I'm working on food allergies research for a long time, and India is the next target for these considering urbanization and westernization in India. So from my slides, the take-home message for all of you and for all of us, I should say, that food allergies and food intolerances are similar terms but distinct conditions. They have different diagnoses to be made. Their symptoms overlap, but these conditions are different. There is variations in diagnosing these conditions due to distinctions. There should be differences in action plans based on individual condition requirement. An action plan should always be customized based on the requirements of the patient. And lastly, India is a diverse country with diverse cultures, diverse traditions, diverse cuisines. So we need diverse strategies for dietary planning and counseling approaches as per condition.